Uh, my name is Misaki Wayengera. I'm a physician by training. My specialty is clinical genetics. So I see children that are born with genetic abnormalities. For this interview, I want to say bonjour, first of all, to the people of France, and say we celebrate with you the Bastille Day. So mainly the patients that I see are kids that are born with genetic abnormalities. But occasionally in our setting, I also see adults that have genetic abnormalities, either that went unrecognized when they were children, or because there was no care at the time. So my research interest is in pathogen genomics. So we look at the DNA compositions of pathogens with the idea of identifying targets that we can develop into diagnostics, therapeutics, and vaccines. So I'm employed by the university as a senior lecturer, but at the same time, I'm in charge of the unit of genetics and genomics. So my first role is to teach. But because I'm a medical doctor, I also have to see patients, and that's part of my community service. Of course, I engage in research, and I do a lot of training, both at an undergraduate level, postgraduate level, master's and PhD, and postdocs. Yes, COVID has impacted my work. Number one is, I don't know whether you are aware, but I'm chairing the Scientific Advisory Committee for the Ministry of Health, which is also the Scientific Advisory Committee to the National Task Force. So I am actually rolling in between, making sure that we have enough evidence to support the response to COVID-19. But of course, one of the things that this place would be littering with students all over, but you notice the population is low because the university is closed. Yes, COVID-19 has aligned my research partially, largely because historically we've been working with addressing challenges like Ebola, TB, HIV, but of course when the pandemic of COVID-19 started, and then we started seeing cases trickling into Africa and Uganda, it was quite clear that the WHO accredited testing platform of the RT-PCRs are not amendable for the village settings within Equatorial Africa. And in order to roll out mass testing, we needed to develop low cost, easy to use diagnostic tests. And this is what we've been doing for Ebola, for TB. So we have a lot of expertise, we have a lot of partnerships. So what happened is that we decided to harness the partnerships that we have, including, of course, Genecast, which is the French company that we are working with, which has produced our peptides for developing the antibody tests, but also is producing the antibodies that we are going to use to develop the antigen test. So historically, we've worked with Genecast for over 10 years. We've been funded by Grand Challenges Canada, and currently we hold 2 grants with the Genecast under the European Union, the European Developing Country Clinical Trials Partnerships, EDCTP. So you can see that we've decided to say, okay, can we hold everything else and address the challenge of COVID-19? Yes, we have, as I have elaborated, we are partnering with Genecast, which is a French company that produces peptides and antibodies. In terms of diagnostic development, peptides are very important, and antibodies, and they need to be produced in a facility that is at minimum GLP certified. And we don't have those kind of facilities here. We occasionally, for the student work, we do some immunization of rabbits in the College of Veterinary Medicine, but that is a crude approach, just to teach people techniques. When it comes to developing a medical product, you need to have at minimum GLP and at maximum GMP certification in order to produce a product that is going to be used on human beings. So Genecast is our partner. They produced peptides and antibodies for us for the Ebola tests for a long time under the EDCTP funding. But at the same time, of course, at this moment, they just delivered peptides for developing the antibody tests for COVID-19, which we have already validated. They work perfectly well. We have moved them to the next step of producing the kits themselves. The antibodies, the process for immunizing the rabbits and the mice is still taking place, and we hope that the antibodies will be with us in September. So yes, we have a relationship with France. Of course, one of the things to tell you is that besides just COVID-19, we've had working relationships with IAC in Lyon, and that's under the WHO. But at the same time, under my involvement with HIV cure work, I'm well known to Dr. Francois Barry, the Nobel laureate who discovered HIV. And the last meeting that we had at the Institute of Pasteur, the HIV cure meeting in 2017, I was there. So I've been in France several times. Beautiful place, beautiful people. That's the relationship. Of course, we would, in terms of the academia, I talk about this because it's a unique relationship that we have with France. But increasingly, we know very well that France for a long time has had collaboration with only Francophone institutions. We wish that France should open up and engage us as the Anglophone institutions as well. So this is the French Liberation Day, it's National Day, and the joke I made to colleagues when is like, there is a movie called Bastille Day, acted by Idris, one of the African-American movie actors. If I am to say anything more, I think I will just say I wish the French people great celebrations for the National Day, the Bastille Day. Thank you.